Een prominente gast op dit digitale zorg-event. A warm welcome to you. How would you like to introduce yourself?
So thank you for having me. I'm Wayne Miller. I work for Zebra Technologies and I'm their solutions lead for Europe, Middle East and Africa for healthcare.
Right on. If you'd not do this job, but let's say be a prime minister, what would you do in this field? What would you like to change in this field?
Specifically, I think it's unified healthcare. We're all citizens of the world. If you want to look at this from a global perspective, we all travel. Before pandemic, we always travel a lot more. And I think it's being the owner of your own record. Mm-hmm. So when we go on holiday, you can take your own medical record with you. So if you have an accident or you need treatment, there's instant access for local physicians. That would be what I would do.
Yeah, that would be a great leap forward, as they say in China.
It would.
Yeah. What makes it so difficult to introduce such a system for people who are presently working in politics?
Well, I think some of it is pure politics. I think some of it is the technology behind it. We're not all at the same level, and you can see that across the globe. And you look at countries like the Netherlands, who are leaders. The Netherlands, Nordics are leaders in technology, but there's a lot of catch-up to be done. So there's not that equal forum for technology across healthcare across the world.
Yeah. Of course, you're not a politician. What do you do?
I listen to clinicians on a daily basis to understand what their problems are. You could call me a gap analysis consultant. So I'm not a physician. No. I'm not medically trained, but I've worked for Zebra for 23 years, and I'm an expert in track and trace and looking at applications, looking at systems, looking at workflow, and analysing the gaps in that.
Let's take a look at one or two moments that you really learned something in your profession. Important moments, of course, because all of a sudden you see things in a different light. What was a special moment for you in terms of learning process?
I think, well, every day's a school day in healthcare. You're always learning. I think getting an understanding of blood transfusion was a real key moment, how important that is. And the two loops, the two controlled loops between donation and transfusion was really important.
When was that?
Oh, that was...
Roundabout?
That was about 5-6 years ago.
Yeah.
Understanding the importance that the different blood types, the different blood components, and how, I mean, it's obvious, it's vital for life.
Yeah.
But what's not so obvious is the traceability required for blood transfusion. So some components can't be frozen, some components have to be used in 7 days. So the health of the donor is important, and it directly impacts the health of the recipient as well. So that was one of those big aha moments.
Can you give me another example?
I think coming to grips with the electronic medical record, seeing the amount of data that you can actually grab, looking at that transition from handwritten records. So I'm a child of the 60s, and there's been incredible change in technology, but I still see hospitals that have handwritten records, and then you see hospitals, and again I'll refer back to the Netherlands, where you've got the cutting edge of technology and the amount of information that's at the fingertips and how it helps patient care.
Yeah. Is there a bigger difference between, let's say, the one or the other European country, or within individual European countries?
No two hospitals are the same. There is very few countries that work on a country basis, and as you can tell, I'm from the UK, and we have the National Health Service, and it's often joked there's nothing national about the National Health Service. No. You go from one hospital to the next, and the functionality is different.
Even within a city?
Even within a city, yeah. I would say that Benelux region, the Nordics regions have got the right attitude towards it, that they're moving along at a constant pace, and there seems to be a country approach to it. So there's difference between countries and difference within countries as well.
How come there's not a real country approach in Great Britain?
It's politics. So they started a number of years ago by creating trusts, hospital trusts, which are essentially financial entities, and they were masters of their own destiny. So they could invest in whatever medical record they want and how they want
their own kingdoms.
They're exactly their own fiefdom. So, and I think it's not a problem, but it creates fractions within that National Health Service, which shouldn't really be there.
And how easy or not easy is it to change all this? Because you're here to change things, to help to change things. Is it difficult? Is it not so difficult?
I think there needs to be a consensus, both political and both from the hospitals and the clinical teams. I think the pandemic helped. I think we suddenly realised it's global.
Yeah.
You know, we are one world. There's no plan B, as they say. And I think now organisations started to collaborate a little bit more. I think the buzzwords of 3 or 4 years ago, interoperability, that's really come to the fore now. So the electronic medical record companies and software providers are starting to be more interoperable, which is allowing that change to take place.
Yeah, yeah. And what was a moment that you had the feeling that you contributed practically to a real change?
I think it was the pandemic. For me, we started to look at traceability of both testing kits and vaccines, and wonderful apps were suddenly written that had taken years to come to fruition, and that we can look at now. We can't cross a border without that app. So I think the pandemic was, unfortunately, a catalyst for change, and very quick change at that.
Yeah, yeah. What annoys you? What would you like to change yesterday?
Yesterday, I would go back to the us owning our own healthcare record. I really would, where I started. I think as being a father and a grandparent, and going on holiday and taking your children and your grandchildren with you, as well as yourself, I think having access to medical records is a key thing. It's 2022.
Yeah.
You know, I think that's what annoys
I mean, this is a dad who's worried, huh?
Yeah.
A grandfather who's worried.
Yeah, exactly. It's our medical record, right? It's our history. It doesn't belong to anybody else apart from us. So I think that would be incredibly useful. Unrestricted access to our medical records, I think is.
What is your idea about how things will change in, let's say, 3 to 5 years?
I think we're going to. So digitalisation is the march of technology. It supports technology on the back of that. So we've seen mobility. I mean, the full-screen mobile phone is about 15 years old. Can you believe that?
Yeah.
Feels longer. And that change has been driven in our personal lives. It's been driven inside hospitals. So clinicians are now reliant on the smartphone for access of information. It also allows them to be more productive. They don't have to go to a communal personal computer to grab that information. So I think it's digitalization, and I think it's modern day technology that's really going to drive the next few years of quick change as well.
What do you think that the great British author George Orwell would have thought about all this? He wrote in 1984.
Well, leaving Brexit to one side, there are positives and negatives, and I think we've become acceptant of sharing data. And when you ask somebody to share data, they don't actually realise they're probably sharing more on social media than they are in their personal lives when they're being asked by their medical record. So I think George Orwell had some things right, the likes of 1984. But I think in a modern day society, in a modern world that's ever changing, I think we need to share more data. It just needs to be done safe. And the European Union, the GDPR legislation is the right move forward to protect our data within those geographical boundaries.
Yeah. Last question. We all know the importance of what we don't know. Scientists, journalists, what they already know is not that interesting anymore. What don't we know? And what is a thing that you would really like to know more about in this field? That you think, come on, I have to have that knowledge.
Data collection is part of it, but you can't just say data collection. I think understanding let's just think about nursing, what a nurse does on a daily basis.
Yeah.
How do we make them more efficient? How do we reduce stress for nursing teams? Nurses are leaving the industry, and we're finding it difficult to backfill them. So I think it's gathering information to improve patient care and to improve the life of nurses and clinical teams over the coming years. And that's without even touching treating disease. That's just a very simple process of that nurse-patient interaction.
Yeah, you want to know more about the human being nurse.
We're people, right?
Yeah. Thank you very much.
You're welcome.
Yeah.